Now to an issue that is too close to home, something that I've suffered from for years as a teenager. And according to statistics, 95% of people walking this earth will or did suffer from this at one point of their lives. Acne, zits, pimples, whatever you want to call it. This common skin disorder peaks during your teenage years and could continue well into adulthood. Actually, 14% of women suffer from acne well into their 40s. But what causes this disease? And how do we fight the social stigma and psychological ramifications associated with it? Let's take a look.
My acne makes me feel so self-conscious that sometimes I don't even leave the house.
I hate how everyone assumes I have bad hygiene just because I have acne.
The other day, a little 8-year-old pointed at my acne scars and loudly asked his mom, "What's wrong with that girl?"
When I take selfies, I have to take them from a distance because of my acne.
Sometimes I feel like if my skin was clear, my life would be different. I'm sick of hiding behind makeup.
My ex dumped me because I refused to cover my acne with makeup.
I don't even take off my shirt because I have acne on my chest. I feel so disgusting and ugly.
Sometimes when I'm talking to someone, they'll stare at my skin instead of looking at my eyes.
I have acne and it's so emotionally stressful. It's brought me to tears countless times. I just want to feel beautiful.
Acne is the most common skin disease in the world, but what causes it? The pores in our skin are openings of follicles for oil to travel up and moisturize our skin and hair. The oil is called sebum. When you rub your face with your hands, you may push dead layers of skin and bacteria over your pores and block them. Creams and makeup may do the same thing. When the pores get blocked, the sebum becomes trapped inside, forming a good habitat for bacteria to grow. As the pressure builds up, the follicle expands like a balloon. Body's white blood cells that attempt to solve the problem, causing further inflammation, what we see as a red dot on our face. Now, when this mixture is trapped under our skin, we get what we call a whitehead. If it manages to make an opening to release its contents to the skin surface, then we get a blackhead due to the melanin in the sebum being oxidized. This blackhead is not dirt and can't be cleaned as such. Sometimes the expanding follicle ruptures, causing inflammatory acne. This rupture may be caused by touching and picking the skin, so it is important to leave acne-prone skin untouched. Acne mostly affects us in our teenage years because of the hormonal changes that causes the sebum production to go in overdrive. But acne can affect us at any age, especially when we're stressed. The stress hormone cortisol has similar effects.
Consider this as a step. You should start from step 1 and go upward. So step 1 is taking care of topical skincare. And by saying that, I mean cleanser, a very good cleanser containing maybe antibiotic, maybe some keratolytic like acids that will peel off the dead skin. And then you are talking about a toner, which will keep your pores closed. So that's very important as well. Sunblock, because people who's having acne, they will have a pigmentation as well, a dark spot which they don't like later on, and this is also a very important point. And creams, whatever creams or lotion the doctor is prescribing, whether it's just peeling off your skin to prevent the pores from being clogged by whatever bacteria or dead skin, or maybe it's antibiotic, or it could be just acids that also will cause a very good anti-inflammatory effect. Step number 2, you go for something that we will treat from inside, which mainly we are talking about 3 points, which is the antibiotic, and we have several antibiotics. And then we are talking about hormonal therapy, which is very important for especially patients who's having hormonal imbalance. And the third is the isotretinoin, which is very common in Bahrain, Roaccutane. Then you can go into many different things because science is exploring every day. So you can talk about plasma therapy, the PRP. You are talking about laser, acid peels, so many things. Even LED, which is just a light therapy, helping to control the activity of the bacteria on your skin. It can be very helpful.